Great. Well, thank you. Thank you, Marco, and our classy staff, and welcome to our friends and colleagues from all around the world. Thank you for joining us again for our Treatment Tuesday. And this slide that you're seeing on the screen now is just a little reminder of some of the sessions we've already had and the dates that are coming up as well. We always want to make sure that we recognize Southpaw. They're the sponsor for this webinar series, and they've been very generous. Make sure you stay till the end because we do have some prizes thanks to Southpaw and to Classy. We're also really proud to be part of Classy and for Classy's involvement in this really great program. Marco was just reminding us that our previous webinars are all available. They're all recorded. This session is being recorded, and you can find them through our website or on YouTube. So I'll turn it over to you, Suzanne, so we can get started with our great presentation for this evening.
All right, let me go introduce our speakers. We have a hot topic tonight, and it's error sensory integration in school-based practice. And we decided we would get a couple of veteran occupational therapists who have been steeped in school-based practice. And so Tracy is our new friend. I think she's a good friend of Southpaw's. She's had over 30 years experience, 21 of those in the school setting. She received, I've got to move my thing. She received her bachelor's in OT from Ohio State, her master's in OT through the University of Indianapolis. And she has postgraduate certificates in sensory integration, NDT, ADOS, autism evaluation series, OCALI. I'm not familiar with that, but she's on a resource team for the Miami Valley Autism Coaching Team. And with lack of money and resources, she works collaboratively with the school community to write grants, create functional spaces, and provide interventions to support the students in her district. And I think you're going to be really happy to hear of the innovations that she's done in her district in pairing with Southpaw to get some of the equipment and activities for her students. Lisa Tess, Dr. Lisa is a longtime friend and colleague. She has been in OT also for over 30 years, 23 of those in the school setting. She started the OT program at Los Angeles Unified School District, and it is the second largest district in the United States. So all by itself, that's incredibly impressive, Lisa. And she's been the coordinating therapist for OT and PT programs. She had a Bachelor of Arts in ergonomics from University of California, Santa Barbara, and got her master's and her doctoral degree at the University of Southern California. She's a staunch advocate. You will see Lisa's name on policy, procedure, on programs. She just had an all-day program on Saturday for the OTAC on mental health and school-based practice. She serves on the practice and ethics committee with OTAC and co-chairs the school-based practice committee. So we are just thrilled to have Tracy and Lisa with us tonight.
Thank you.
Okay, I'm going to turn it over to you, Lisa. Oh, well, and also, just as Zoe said, don't forget the drawing, because right at the end, we'll do the raffle, and they're pretty awesome prizes. All right, I'm going to stop sharing and hand it over to you.
Okay. All right. So thank you, everybody. And I know that both Suzanne and Zoe and their Classy team will be monitoring the chat both on Facebook there. So we are thrilled to be here. We're going to be really just to kind of go how this presentation, we're coming from a larger, broader perspective. Then we're going to go a little bit narrower. So kind of go along this journey with us. And our foci clearly is looking at applying principles of sensory integration in the schools.
And really, we want it to come from that perspective of how do you provide sensory integration in the schools, given the context, right? Resources, space, organizational structure, and the roles. A couple of our assumptions when Tracy and I were looking at this as we talk about this and as we talk about kind of coming on and looking at whether we're talking about a tier 1 strategy or a tier 2 strategy, we're assuming, right? They has a knowledge of sensory integration, that they continue to take courses right beyond what they had in their basic education. Both Tracy and I are SIP certified. I've done the ADODS training. I continue to take training on an ongoing basis. So we're making that assumption that when we're looking at this and we're looking at that application, that someone has that background, they have the training, and they have the advanced education beyond their base degree. And then that as we look at this and as we know some of the research, and it talks about studies and the efficacy of using, whether I'm using a weighted vest or I'm using a therapy ball, that when we're talking about general strategies that can be applied within the classroom, general tier 1, tier 2 strategies is very different than we're talking about a child specific strategy. And so being able to differentiate that is important when we're looking at efficacy, and also when we're measuring for child specific, how we measure progress or lack thereof. So just a little bit as we go, we're starting in this global perspective. So some in the United States, we know there's people from all over. So in the United States, there's something that's talked about as multi-tiered systems of support. And the idea of multi-tiered systems of support is that this is not just for special ed, this is special ed and general education, right? So that it's this framework where we can provide support to all students, and that we know that students are diverse learners. And so when you look at, often you'll see this triangle at the bottom is, what can we provide for everybody? What are we then, as you move up, what might we provide for some, and then that few? And so as we talk about this, we do have some references that can look at, but this is something that's specific in the United States, and it's a way of providing support. It first originally came and it was looking at behavior, and it's really generalized. So things that used to be maybe strategies that were only done for students that were identified with special education, of now looking at how do those strategies look and what does that look like and what can we provide for everyone so that they can access their educational program. So that's where we're going to start, which is a more general, and then we'll get to specifics.
So as Lisa mentioned, tier 1 is something that's going to benefit all the students. So some examples are usually getting the kids to become more organized and include some calming and movement activities. And some examples I put up here, better evidence-based, are using sensory enrichment rooms and sensory motor pathways, some school moves and brain breaks, just to get the students ready to participate and engage and be able to attend and embrace their academics and participate in the classroom. So one strategy that we use for in the United States at one of my school districts is a positive behavioral program as well, because we've seen the increased need for the emotional regulation and the trauma students. So they've included, and things changed with this tier 1 depending upon the community. For example, is what is our PACS? It's a positive behavior program. So it's embracing the concept of the community and the needs change. We keep changing what the tier 1 support systems are to support those students.
Mm-hmm. And I think one of the things I see, you know, when one of my, for those who, I know some of you on this call, I don't know some of you, but I have a few little things that are, I will call my pet peeves. So when we're looking even in terms of yoga for the classroom, right? We are all occupational therapists. You're looking from your occupational therapy lens. So even when I'm looking at some of these things that are maybe not developed as by an occupational therapist, you're still looking at from an occupational therapy lens. So if I have somebody in a yoga position or they're in downward facing dog, is that providing vestibular input? Is that providing prop? And so still it requires that knowledge of that system and ensuring, right, what are you bringing into the table? How are you looking at that? So I just, we're still always first and foremost occupational therapists, and we're coming into this system and we're seeing how we can best support our students so they can access and learn.
And to add to that, Lisa, and when we did a sensory motor pathways at tier 1 and a tier 2 support in our school district, we also added some of our therapy terminology to bridge not just what we're learning and have to know the curriculum for what the education model is, but also to help the teachers bridge to understand some of our frame of reference with where we're going and why our methodology is from a sensory frame of reference. That's a great point to bring up.
Absolutely.
And that also feeds into our tier 2 supports as we go into the next system where it's a little bit more student specific. So we have what's called an intervention team in my state where the team meets so that if a student is struggling beyond the tier 1 supports and still struggling with like staying in their seat, acting out, not picking up handwriting, not copying movement and motor planning with songs, what might be the barrier and supports that we can bring to this specific student when the team meets to trial and get them engaged in those curriculum activities and participate. So the occupational therapist may use some evidence-based approaches and support with the IS, the intervention specialist teacher, and do maybe a handwriting group, such as Handwriting Without Tears is one that we use that we know uses a multisensory approach as therapists. It looks at the motor planning and the sequencing of the letters and bringing some of those principles as well to the table for the child. It also might look at some sensory motor groups. So setting up things that might be that the students having difficulty copying from the board. Maybe we're going to do some more vestibular based activities, working on some oculomotor activities in addition to support them and with some grasp. So it's a little bit more specific towards what the students' barriers are for learning, but yet not yet gone to this third tier where they've referred to occupational therapy directly in the school model.
Mm-hmm. And I think just kind of another example that we did right before the pandemic, we didn't get to see it to fruition, but in that tier 2, it's usually identifying a cohort, right? As Tracy said, of students that maybe are struggling in this. So what we had started to do, it was a school site where we have a therapy room. We had the teachers had some data that they collected. We then did, oh my goodness. And of course, I'm forgetting right now, but we did 2 screening methods. And then we had identified a small group of students that seemed to, and some in this process. So the therapist observed within the context of the classroom. There was one student we referred to right away for an evaluation for an IEP. It's in this particular school is in an underserved area. So there certainly is not a lot of opportunities for students to access playgrounds or parks or things like that. So when we looked at for those students that were falling out of their chairs or things like that, had to look at those factors. But then we identified a group based on the data that we had. And then what we were doing, we're pulling those students out and running, using the suspended equipment, but running a group that was then targeted. And then our plan, we were running that group. It was going to be twice a week for a 6-week interval, and then returning back, looking at the data and then seeing what those next steps were. So that was something very systematic that we did in concert with the school site team, and really trying to come in from a very specific approach and seeing, was this effective, was this not, and then what further intervention was needed. Okay, so this, Tracy mentioned this. This is the student study team. So this is, and when we're talking, we know we have an international audience. So we do know that these are terminology that are used most in the US, but that student study team is where we can get a little bit more specific. It might be for someone who's not identified yet for special ed that we come observe when we provide a consultation. Or it might be somebody already with a educational plan, a special educational plan, that then has been referred for us to do a comprehensive occupational therapy assessment. Tracy, did you have something? It sounded like you want to. Did you have something you want to share on that?
Really, the state of Ohio, I don't know if it's the same internationally, but we can practice off of that once it gets to the tier 3 support as an educational referral for occupational therapy without a doctor's order. So when we are given that referral, it's because those other tiers are not working enough, and we need to dive a little deeper. And then we usually work collaboratively with the medical model here to see if they are getting outpatient therapy services, maybe even at an SI-based clinic or something like that, and get more data to drive and get more history medically to get a better holistic assessment and to drive which direction to go to do our assessment.
Great, great. So here even though we wanted to introduce a couple concepts that we use a lot that are kind of common now in the States, but it is universal design for learning, and a couple things that Tracy and I wanted to kind of talk about. And from our perspective, this is where we can fit in our knowledge of sensory integration and how we can support it. So part of that, right, is engagement. We're going to show you what the placemat looks like, and we have a reference for that. Executive function and self-regulation. So this is hard to read. You have this as a reference. This is on CAST, which is the Universal Design for Learning. It is in a multitude of languages. So I know that there are people that are on this webinar that are from Latin American countries, etc. So this is in a multitude of languages. But why we wanted to show this is really for all learners. But if you look at engagement, right? How do we provide multiple means of engagement? Provide options for self-regulation. For so many of our students that we work with, this is a challenge, right? How do we do this? You come in over here, action and expression, and you see, right? Provide options for executive function. So one way that Tracy and I have found that we're really successful is that, working within that system and understanding it, and then how do we kind of work collaboratively together so that we can support the students from our lens. And so this is something we would suggest that you look at more. And this is something that applies for all students, whether they have specific special needs or they don't have special needs. This is how we can all learn and present information so everyone can access.
So working within the school model with limited resources and being creative where you can work, and what does that look like? Is it a shared space, not a shared space? Does the teacher need a safe space in their classroom to really meet and look at those different tiers and use the resources to the advantage that you can? It's really important to use our therapeutic skills to look at the environment, as well as the placement of where things are going to go, why the whole system, and use a collaborative approach. It really needs to be driven by not just the occupational therapist, but the rest of the team, such as the physical therapist, the intervention specialist, and what's the purpose of the room? Is the purpose to be more of a community-based intervention room? Is it also going to be used for a pull-out room? So when I look at the spaces in my school settings, because even within the same district in different buildings, they're all very, very different. Same with the funding. So I tried to simplify it in one way so that it is used, some of the strategies can be utilized by teachers, but also if I have the ability to use my spaces, more therapeutic driven spaces where you need more in-depth knowledge and sensory integration based frame, and using your swings and your equipment and suspended, and have that theory to drive what you're doing. So my spaces are created very differently, and we collaborate about this. So some examples are, just to keep it more simplified, using one of the big therapy rooms that is also a sensory space, is just kind of setting it up to one side as a calm side of a room. And so some strategies that we might have on one side of the calm room for a child that just needs a brain break or an emotional regulation break, or they need some deep probe because they're struggling with body awareness in space or something like that, that's going to drive what the child is going to be using in these rooms. So some examples are the beanbag chairs, the lap pads, the ball pits, some fidgets, and a variety of fidgets, depending upon the child's interest that they're gonna, want to manipulate. And bubble light table, we might put like puzzle parquetry designs on them and give them that creative opportunity at the same time to get the child to, again, calm, but also start getting some initiation and participation before they transition and are calm and organized to the classroom. So those are some pictures just to give some examples of a space. And then on the other side, I just, again, just for simplicity, created more of an active side. So if a child needs to, which is usually where the children come in and the students, when they come in dysregulated, we're going to go to more the active side is kind of our sequence that we go. And depending upon what their needs are for therapy, this is where I will utilize, actually in this space, I have a suspended swing, a southpaw swing that we'll use therapeutically, but my teachers will not be, I don't feel are skilled to use it. I've seen it be used inappropriately. They don't have that depth and knowledge of our air sensory integration theory, and I can train them and set up some safe things that are more linear based and more closer with lowering the swing to work on some postural things versus the vestibular, that rotational. So some things that we have in this room are the crash mat. It's always a go-to. It's a big hit. Same with the deep squeeze machines. My kids with that struggle with that, some of that body awareness in space and that need for deep pressure. We've got some weighted balls, and we've got a balance beam. We might have a student child carry a weighted ball across the balance beam, for example. They might be interested in jumping for the stars or feeling the sensory things. So those are just some things in the active side of the room that we've seen really good successes with. Use it a lot with transitions to coming in from recess, or the students struggling from lunch back to the classroom, that we can set up these intervention supports for them daily so that they can participate more frequently in the classroom and learn.
Right. And I do know that somebody raised their hand. Well, Suzanne and Zoe and team are monitoring that, so they'll see, let us know when they want to take those questions.
Right now, we're just getting some questions about some of the specific equipment you're mentioning. So maybe we can circle back to that. We'll keep track and then we'll ask you at the end. Okay.
Okay. Thank you, Zoe. Okay. So we're going to transition a little bit, and we do know that this is a term that's used within the United States. So within the United States, students qualify for special ed. First they have to meet the criteria as what they would call an individual with exceptional needs. And there's 13 different handicapping conditions. It could be autism, it could be specific learning disability. So there's a number of things. And then we, as an OT, Tracy and I will talk about that. We would do a comprehensive assessment. So when we're looking at occupational therapy as what they call a related service, it's always going back to that educational program. So how can we support that student to access and make progress in their general education program? And we know they might be not following a gen ed curriculum, but we're still striving for them to be in that general education program. It requires to understand, as occupational therapists, what's that learning framework look like? What's required of students? So it looks very different what's required of someone in first grade in Japan than someone in first grade in the United States, right? So what are those standards and how can we support? We want to reduce those barriers. How often we provide occupational therapy and what it looks like is based on assessed needs. And then we also want to support access and participation, and look at those other times, right? Look at the cafeteria, look at the playground, look at some of those other settings, and how can, depending on the model of service delivery that we're providing, how do we make sure that's carrying over to those other environments that that child or that student is participating in? Okay, so assessment. So assessment generally, right? So I know that we're a little more general right now, but assessment generally, right? Assessment generally, we're going to look at that student in their learning environment. We're going to do some standardized testing. We're going to do some more structured observations, some clinical observations. We're going to talk to the student. We're going to talk to the teacher. We're going to talk to the parent. We're going to identify what things are barriers to that student being able to learn and what supports are in place. And again, coming back to knowing what's expected, right? What's expected for someone in preschool? What's that curriculum look like? What's expected for someone who's in 11th grade? What does that look like? So that's the general part of an assessment. And then this is not all of the assessment tools that Tracy and I use. What we wanted to do was offer some tools that we might use that are still coming from a perspective. So the first one, the easy, which is in development. Most people on this call or webinar are familiar with it. The brief is coming and looking a little bit more at executive function that's coming in to target some of those things on that universal design for learning. The BOT, yes, is a motor-based assessment, but there are components of the assessment that can look up bilateral coordination, does look up balance. The SIPT, can still be used. There's a lot, especially that tactile piece of the SIP where it's going to provide a lot of really good information to the sensory processing measure and the sensory profile, which is one aspect. That wouldn't be your only aspect you're using to look at sensory integration. And then the structured observations of sensory integration, which recently came out over the last couple months.
I was just going to add that it's an opportunity for us. I know where I am I've been bringing up to my team and my supervisor the importance of going backwards and looking what assessment tools we are. So we're actually in the middle of that process because culture is changing, needs are changing. So we need to kind of update what we're doing. We have new releases of great new assessment tools, and we need to start getting those integrated, I think, for our population. So I'm excited that just came out. So when, as we talked about the intervention support team, kind of sending a referral in where we live to occupational therapy for that tier 3 evaluation piece, we usually get a little bit of information as far as what they've already tried, which is really helpful, and identifying what the barriers are, the teachers' concerns are, the parents' concerns are, the academic concerns are. So when I get a reason for referral, I look at that. So what's driving what I'm doing? And in this case example, I have a student who's coming to me that's not engaging and shutting down with all academic tests, having trouble staying in their seat, not really engaging socially, seeing more aggressive behaviors, and not really doing anything with their school tools, whether it be scissors or writing with a pencil or crayon. So that's going to drive kind of, okay, what am I testing for? And then what do I know from a brief classroom observation or input from the teacher? Well, she's got some tools that we created in her calm space of her room and some things to pull and use as tier 1 and tier 2 supports. So for example, a weighted animal seems to navigate towards that and put that on his shoulder, on his lap, and navigating towards affirmations of hugs from the teacher. And so I'm seeing some patterns. And once the child is engaging in those activities, they are sitting down for a couple seconds and getting some brief engagement. So that's kind of given me a little bit of information to drive my testing again. So this is a student that it was referred to me that's already in special ed, but is new to OT. They were changed recently to a cross-categorical room, and then later occupational therapy is being pulled in to assess. Very standard a lot of times for us because you get the medical diagnoses later. So some sensory assessments that I had access to was a sensory processing measure, just to dive deeper. What does that look like? What are the sensory identifying needs that the teacher's seeing in the main classroom? To give me some information to know what some barriers to participating engagement and using your body and managing and organizing, what's holding back from using the tools and so forth. The other one that I pulled in, I use it a lot more also for observation, not just numbers, and extrapolating that assessment piece. What does this mean? If a student is struggling and has a deficit in fine motor skills, what does that mean? And how do I put the two together? What does that mean from an air sensory integration frame of reference? Am I seeing some patterns? Is there an oculomotor problem? Is there a vestibular problem? You know, what's impacting grasp? Is it a postural control? So when I look holistically at a student, I want to know that information before I develop my goals, my treatment plan, and my evidence-based things that I'm going to work with. So we embed opportunities for vestibular and heavy work with the student a lot. And it took us a while to get there before we could get some successful transition to seated activities and a lot of tactile things, because he had a lot of difficulty with touch perception and body awareness, and really using his hands, just what was driving back the grasp. And that's kind of what was driving, seeming to be, was more of a sensory reason that he was not using his hands as much versus the strength. So what am I doing and why? And I want to know that, because I want to know what strategies then when I'm not there, because in this building, I'm only allowed to be there once a week, which is not near enough for what we want to accomplish with the student. What supports can I do to help and task modify and give as strategies to engage and to participate and keep working on those patterns to get them to develop those skills. So whether it's using loop scissors, whether it's using just, you know, a shortened tool with a gripper, or something where you eliminate one task part of it so you can just work on the motor planning. You know, what am I using and why? So I'm always going back to that to drive my treatment. And what am I getting for outcomes? Did it work? Did it not work? What do I need to modify? So I'm constantly problem solving, even within my treatments and then my observations in the classroom. So I do a combination of pull out, and I also do some push in, because I want that continuity.
It's fantastic. Really, really comprehensive. So just right along with what she was saying, this continuum of service delivery, and Tracy really spoke to that. Right? So we might come into the classroom, which is, the term is called push in. We might pull out. Again, that just might be pulling out to a classroom, right? Or then we might pull out, and then this is where it comes in, right? Looking at that ASI, right? We might pull out, we might use playground equipment. There's something, there are, you can hang, there's a, not thinking of the term right now, but you can hang from the playground equipment always, right? Safety, right? Or you can see, these are examples of one of our, we have a lot of district therapy rooms where we have specialized equipment. So this is one of our, an older space where we had a C-frame. We have a C-frame here in terms of it, but we have our particular district, we have 20 district therapy rooms where we either have, most have support structures with multiple points of suspension. Okay, I believe this is Miss Tracy.
Yeah, I just wanted to reinforce again, when we do push in, sometimes it is the classroom, sometimes it is outside at the playground, sometimes it's, you know, in the cafeteria, wherever that need might be for a child, it's because they're struggling with that functioning in those areas as well. So using what we know as an occupational therapist, thinking about where a student's placed at a table, where they're placed, you know, getting them integrated in socializing, what can we do to set up even at the playground and modify to help them engage with a peer or an adult, or make them successful to keep reinforcing those skills? How can we get them to use utensils? You know, I've collaborated with a teammate, how that children in preschool are being given everything to squeeze. They're not using spoons anymore like they used to. So that's impacting society, that's impacting development. So how can we get that going as well when they transition to school age and even younger, and trying to get those skills, because grasp with the utensil carries over into grasp with you know, the writing tools and everything else we do. So when we look at push-in, I just wanted to reinforce that it's also looking at all the environments and not just getting the standard handwriting classroom and all of that a lot of, you know, we look at as occupational therapists. There's a lot more to it.
Absolutely. Absolutely. And here you go, even more on that.
Oh, yep, improving access and participation. We want to limit those barriers. We all like to be included. We want to play. We're play-based therapists. We want to use that. We want to incorporate that. We want to help students with feeding sensory sensitivities. What can we do to help them with that so that they can sit with their peers at lunch? So just looking at that in general, I just think to reinforce one more time and making them successful. And I didn't mention before, functional positioning is always key. Maybe a student needs to lie down on their belly to, have the calm body to, to be able to write or to be able to color. Maybe they need to stand. That's okay. Using spaces within the rooms and the environments to set them up for success and their needs is also important.
Absolutely. Okay. Oh, this is still you.
Wow.
Wow.
Okay. So I have had the great opportunity to think creatively out of the box with limited resources in one of my districts and be through building change of new buildings with another district. So it's really important, in my opinion, to become collaborative part of the team in all of those areas. In the new building, I'll start with that because that's always exciting to start with. Being a part of that building construction, pulling in Southpaw before they finish the ceilings when you want to drop the suspension swing, right? Is a lot better to do in the beginning than it is to cut the holes and figure it all out later in my current building. So I've had that positive experience. I've been really thankful for Southpaw coming out and doing that for me and help giving me advice for placement, working with our construction people directly. I can kind of get the ball rolling, tell them what I'm looking for, and then kind of step back and then let those guys take care of it. And then boom, I show up the first day and it's all taken care of. It's really nice. But I think it's just being part of those building plans and just also not just for our therapy space, but also the school community, because the needs of that suspended equipment or those sensory spaces are needed more and more for just even tier 1 and tier 2 students, for example, that might need access to a deep squeeze machine as a transition or something like that out of the cross categorical room. We've created spaces in our building construction design outside those classrooms on a more of a main hallway that we are involved with as a collaborative team member. I think that's I can't reinforce enough for having the different spaces if you can have them. And then if you're in a current space where you might get not much of a room, or you might get able to work and get PTO. I've used PTO money to design a room, like some of those pictures you saw, working with the intervention specialists, my principal, my administrators, knowing where those funds come from and knowing what we need to fight for and advocate for is huge. I feel like it's an ongoing battle that we always have to do, but we got to keep doing it, and it just takes time. And so I'm excited to see that we finally just recently got some of this equipment in place by those resources. Some other resources I've used, I work a lot with my teachers. We write grants. We have some school-based grants that within the school district that they can apply for and get money, and they can utilize sensory tools in their classroom to, again, reinforce that engagement, that participation, that brain break, whether it's a beanbag chair or the weighted animal or some little fidgets like that as examples. And then also, again, if they want just a calm room outside right by the office, the referrals are coming up, we're trying to use that positive behavior. What can we do as a team to integrate that? Same with the sensory motor pathways. What can we do to get the funds to support those things as community tier 1 and tier 2, in addition to what we need as therapists to treat? So those are some of the resources I've done, helping them write grants, working and knowing when they're due, working in our local community businesses, and going to the Rotary Club is one of that we have locally, and attending one of their meetings, tell them what you're looking for, get involved. I'm already linked with them with our special ed soccer and those resources, and really using that community-based function as well, not just in the school. And then lastly, I use what we have in our school. So we are in an agricultural setting. So we have the opportunity to have a wood shop, and we have FFA. So we have kids giving back to kids, which they love. So I might say I need some slant boards designed or modifying something for accessibility, and they design it. and it doesn't cost that much money. So those are, and then same thing with job tasks. We work as a community with trying to integrate. If I have a student that's really working on bilateral coordination skills and deep input, they might have a peer where they're maybe sweeping in the classroom, and just thinking holistically, self-care, life skills, and all that, not just with the younger kids, but also as the kids get older.
Oh, that's fantastic. And I'm going to highlight a couple things and then just move us so we have time to be able to answer questions. A couple things that we wanted to highlight, and we have some examples of this, is really reflecting what that space is going to be used for. So I know that Tracy talked about it, but we wanted to emphasize, right? Is it a room where you're going to work, you're going to be providing occupational therapy, right? With that use of suspended equipment, or is it a space used by the students, and what does that space look like? And we have some other examples that we'll go over. And then we wanted just to emphasize for those where we do have set aside therapy rooms with suspended equipment, there is making sure there's a protocol for cleaning, making sure there's protocol for checking the equipment, all of the equipment when you get it, looking at it, whether it's the squeeze machine, whether it's any of the things that we've shown, there is something at the beginning of that equipment that equipment needs to be checked off on a consistent basis, and check for the hooks, etc. So make sure that you have a process in place for ensuring safety.
And I'll tell you that the equipment we've gotten from the South Pole too, it has the checklist with it. So I love it. I just get it, I put it in a book, and I make sure my administration knows, my custodian's my best friend, and make sure everything gets checked off. So it is important because the equipment is being used and it does break down. So you need to keep that safety in mind.
Absolutely. Yeah. And so we're going to just to be able to move in terms of some questions. Just briefly, these are some examples. You're going to have access to this. This is just in a sensory enriched room, so you're going to see it here.
I say I made that super simple so teachers can use it.
Absolutely. Here are two examples that we wanted to talk about. One room, the information on the left was a room for children with more moderate severe challenges, and originally the school wanted a space where that person, if they were having behaviors, and so this was a multidisciplinary coming up with very specific guidelines. And you'll see both this and the last slide where we're Tracy and I are emphasizing self-determination, right? Promoting self-determination, promoting age-appropriate activities. The last space that we looked at to design was something for a neurotypical gifted and gifted autistic, both middle and high school. And again, really thinking about what's appropriate to have in that space, right? Thinking about the age of our students, thinking about what's appropriate. What do all of us as adults on this call need in terms of space, and making sure that as occupational therapists that we're always promoting that self-determination and looking at those supports and the research. So pull out for therapy room, just to give, because we do provide, and that's where both Tracy and I have been talking about that, using under the principles of air sensory integration, right? We've got multiple points of suspension. We're looking at that student. Is it carrying over into the educational setting? It does require advanced training. I know we certainly provide, as a program, we have provide ongoing support for our clinicians in this, and particularly do not assign somebody first year where they're starting practice and someone who does not have advanced theory. So a little bit of, we wanted just to touch briefly, we're going to go through so we have time for questions. This is an example that comes up a lot. Student who demonstrates an adaptive response. Why we look at students for therapy room, one, they have an adaptive response, right? We know if they have the sensory input, it might be that they need that more specialized environment. It could be because we can provide more intensity of sensory input, or the variety of opportunities. Maybe it is that motor planning, it's the praxis, and they need to be able to have that variety of equipment and be able to explore in a safe manner. We won't go over this particular example, but I think both Tracy and I want to challenge people to look at, if you've got a student who has some handwriting concerns, and in the United States, it's the number one referral for occupational therapists, is to challenge yourself to look at, is it praxis? Is it something else that's interfering with that student's ability to be able to do handwriting? And is there another way that we could approach it? So it's just, that's our challenge, just to think out of the box, to think about what the typical piece is and how could you approach and look at that student differently. Okay.
And I've actually, just to add to that, I have separated out my goals so that I have my own goals to drive and educate others what I'm working on and why, to support those academic engagement pieces. Because I found when I was under the handwriting goals, that was getting lost. And for what we need to do to help our students, I think that's important to look at. So, always changing. One of the interventions that we mentioned that we use as support are the sensory motor pathways. And I just wanted to just touch on it, as far as we have one that's in our building that we put up that are just kind of integrated in the community of the school. And they're just structured sequencing motor tasks. And the goal is to really refocus the mind and body, whether it's a transition while the kids are waiting for the bathroom, but it's also an opportunity for the kids to get their movement and body organization needs when they're not going outside playing, because they don't have those resources, or they're not going to the parks by their parents and so forth. So it's integrating those into their daily routine.
That's great.
And here's some examples. So again, we do put down what we're doing and why. So if I have a kid that's struggling with integration with crossing midline and just motor planning and sequencing, we might just even work on some of the jumping balls. We might work on, say, hey, for the intervention specialist, you take them to the hands wall stand and have them try to find the letters of their name and spell them out by keeping one hand on the other as you move to the next. And that motor planning sequential, we try to do a little bit of inversion with the hand development too there. And those are just some picture examples.
Great. And then this is, now we're looking at really student specific strategies. And we want to emphasize, this is based on the assessed need, right? The strategy is aligned with that assessed need, apply the evidence, right? Ensure safety. And you'll see that I'm probably a little more conservative where we are when we're doing something like a weighted vest or a log roll or something like that. We have a consultation form that we provide, how we, when it's used, how we're using it so often, how often, so that when we're looking at applying a specific sensory strategy, we are data on it, but we're also really aligning that strategy with the assessed need. You'll see when you look at the literature and the use of sensory strategies, are they effective or not effective? Sometimes they're just haphazardly applied, without really specifically looking at what strategy that you're using and why you're using it. So that's just our piece there. And then just resources that you have, right? AOTA's got children and youth with challenges in sensory integration, sensory processing. This is a fantastic resource. This is a great OT and children and youth using sensory integration and methods in school-based practice by the American Occupational Therapy Association. Most of the equipment that both Tracy and I are referencing is from Southpaw. And then here are just articles for you that you may look at that will have information. So we will take questions. Zoe and Suzanne.
Okay, well, thank you so much, both of you. That was a lot of information and there's lots of comments and questions. Thank you so much. I'm just going to post one in the chat that came in the Q&A that I think a lot of people might be interested in. Let me see if I can get this up. So can you see that in the chat? This came into the Q&A. What are your favorite effective pieces of big or intense equipment that you can bring in and out of school when there's no space to leave things at school? I think that's a common challenge for our therapists in the schools.
Well, I can actually speak to this just because
Sure, go for it.
recently we're trialing out new equipment, and believe it or not, I did bring it in and out very easily between buildings. I have a lot of buildings that have emotional disabilities, cross-categorical rooms, and then we have the students that aren't being served. So it's really not that heavy. I carry, believe it or not, a deep squeeze machine in and out of my building to trial with students and use with students. I think it's important to trial it to see if it's effective and if it's getting the adaptive response I'm looking for before I have my buildings and my districts that don't have a lot of resource money before they purchase them. So that is one of my go-tos. And then I do carry some of the weighted like lap pads and so things like that too that aren't as big to trial, or a weighted vest like Lisa was mentioning, because I do find a lot of times it's the deeper input and the calming things that they're looking for.
Thank you, Tracy. Suzanne, I know you had some kind of important questions you wanted to have Lisa address. We have a lot of kind of specific questions asking for what certain pieces of equipment that you've mentioned are, maybe some examples of goals. So I wonder if maybe we can kind of follow up with you and post some of those later. But I know that Suzanne had kind of an important topic to bring up.
Well, I mean, there's so many things, right? You guys did a fabulous job. Thank you so much for taking the time to put such an organized presentation together for us. I think one of the questions that we often get is that when you are training, cross-disciplinary use of sensory tools in schools, how do you do that training for the one-on-one aides or other professionals? Because what I find is that sometimes you get people that are just so wonderful and use it well, and then some people just don't have a clue what they're using. And I know you mentioned that with the swing. So what about training when we're leaving tools behind?
At
So
least
for,
I might have
for
different
us, yeah,
ones.
we'll talk about it. I'll let Tracy fit. So for us, we don't have any suspended equipment where other disciplines are coming into use. So I'll start there. We do not. And for us, that anything is child specific, we have, and whether it's a log rolling, whether it's a weighted vest, whether it's a pressure vest, we have a consultation form that we use. And then that student is still on service, and we're obviously following up and looking at data collection. So we're quite specific and would not just provide a something that's child specific unless there was an assessed need and it was on our caseload.
Which ditto on that. But I will say I have taken down the swings where it is shared space with the teachers, because I had a staff changeover in a lot of my buildings this year and walked in, had transfer in students, and I'm like, what is going on? The students are beelining for the swing that I didn't even know was up and hadn't even been inspected yet. So I think going back to that safety protocol, being right there, and I just took it right down and we had a collaborative dialogue, because I do feel the suspension equipment needs to be by somebody who has a deeper certification in theory and sensory integration for safety.
And I think my follow-up question is, right along the lines, and Lisa, maybe you and Tracy, you already answered that, but I have been in IEP meetings where the administrator will say, well, we have the OT activities, we don't need the OT. And that I find very concerning, that maybe the behaviorist is saying, well, we're doing the sensory break, so OT isn't necessary. And I find that very concerning.
Well, I can speak where I am. We've gone from 3 to 13 in our staff. So we're not having that issue. And so I feel, but I've also been on my team for 21 years. I do a lot of in-servicing. I do a lot of why the referrals. I'm the one that's been with them developing the intervention strategies and when they need to come to the referral process. I'm involved in my intervention teams. So I think that's important collaborative dialogue and conversations that you need to have on your team to drive the philosophy of the program and the role of occupational therapy in the schools.
Absolutely. And I think the other thing we've done, especially we're everything, right? Is it that same question, right? Is it sensory or behavior? So
Yes.
at a larger macro level, we have developed a lot of training. So we actually do school site trainings where we look at that flow chart. We go through and look at the behavior piece and how do you analyze and what, because we know all behavior is about communication. So what is that? And so we provide a larger professional development. And then we also guide, because I think clinicians, especially when they're doing sensory diets, will do this whole like list of stuff. And they don't systematically look at one strategy, see if it's effective or the other strategy. So I think it's also how do we do that data collection. I know we didn't list it on the our resources, but I think it's from data to goals and back again, but it's a resource that really looks and drives home how you can measure data and look at the efficacy of it.
I have.
I was going to say that reinforces the reason in educating the team to, in my opinion, as to why we're assessing, what strategies of evaluations resources we're using to drive what treatment strategy we're getting and go to our goals. And that's one reason I separated out my goals now, because I want the team to know our role. And I thought it was important. I know the education model here has gone back and forth. We should be under the teacher goal as a related provider. I am a related service provider. However, my role is different. So my goal is going to be different. And I don't want to measure handwriting. So I changed my approach. Well.
And that's certainly one way. We do both of that. So we both have stand goals that are unique and shared goals. We also require, which is a little bit different than other places, we require the occupational therapist to have an intervention plan. And that intervention plan is quite specific of looking at what is being addressed. So even if it is a shared goal, then that obviously they have an intervention plan where they're looking at it and how does that look different.
Yeah, and I agree with that, especially the child gets older. I end up doing some objectives on the goals. That's true. And we do an intervention plan as well. And I do a lot of in-servicing. I've done all day in-servicing, believe it or not. In-servicing.
Oh, that's great. I have one more. It's a big question, and maybe we don't have a lot of time, but I'm going to throw it out here, and it's on scope of practice. Because there are some people who are practicing in schools who may or may not use air sensory integration. But what we find is sometimes, even from an administrative press, that the scope of practice for OTs in the school is very narrow. I mean, down to like they're doing handwriting and you have lots of handwriting goals, but you're not expanding out. And it's not just air sensory integration, mental health. And I don't know how we address this in the last minute or so, but I think I want to bring it up because our occupational therapists have a broader scope of practice than handwriting.
So
I was going to say, and Lisa, you might do this with your team. Sure. I'm trying to pull my team together to look at scope of practice. We've grown quickly and a lot of different expertise levels and skill sets to bring to the table. So I want to have team collaborative OT dialogue about assessments, about what our role is, and a philosophy for our programs. That way, if that way the students know what they're getting, whoever would contract with us, that we're all more systematically trained with philosophy and all that. And it might be some hard conversations, but great conversations. I think that's a need.
And I think, well, for those who have worked with me, a couple of people on this call have worked with me. I have my little soapboxes. One is that handwriting piece. It is certainly an outcome, but making sure we're looking at the why and those underlying skills. Tracy mentioned it, right? Is it tactile discrimination? Is it the postural piece? Is it praxis? Is it what is that? Is it that ocular motor control and near point, far point copying? And that's where then really driving understanding through that assessment. In terms of that scope, I think for us, again, it's a training piece. We have a comprehensive assessment that has all areas that we look at aligned with our practice framework. So we're, whether we're looking at a preschool, middle, or high school, or we're guiding for that larger picture and making sure we're looking at all those areas related to
and I think to build on that is getting that adaptive response across a lot of areas, not just a splinter skill. So that's why you want to work on that area, you know what I mean? So that it carries over into those other areas that are of need, not just handwriting, for example.
Well, what I'm hearing is that you guys have modeled advocacy and leadership in your districts. And I just want to thank you very much. I think we're out of time today, but how wonderful to have both of you here. I don't know, Zoe, if you want to.
Same thing. I mean, it's really heartening to knowing, I haven't known you as long, Tracy, but it sounds like you've been working at this for a long time. And I know that Lisa has given her heart and soul into this very large school district and has established such strong standards. So we so appreciate the credibility and scholarship that you've added to our practice. So thank you so much. Mark did join us here from Southpaw. I don't know if you want to pop in and say hello, Mark, but we do have our prizes, right? So who does that? Who handles the prizes?
I do that.
Oh,
It's a
Marco.
pleasure to do that.
The
Thank
fun
you
part.
so much. Yeah, and some people were asking about the replay. We'll be sending the replay by email. It will be available on Classy webpage and also on YouTube channel. But right now, we're gonna see.
And we'll see if people have asked about like examples of goals and some of the resources. We'll do our best to pull that information together. I know you all did such a great job with the PowerPoint and you have resources listed. So we'll share that. Thank you.
Exactly. And if that's possible, we'll also send it by email so you don't have to worry about it. Just check your inbox. All right. So as you know, we have two prizes. One is an easy starter kit, and the other one is one piece of equipment, Southpaw equipment. And the winners for this webinar, and I'm going to share my desktop real quick.
Never know how you do this, but we're always so happy that you can.
Here we go.
Wow.
Charlinda Parsons is the winner for the Easy Starter Kit. Congratulations, Charlinda. And Rise
Congratulations.
Taniguchi, and I hope I'm saying this right, is the winner for the Southpaw equipment. So congratulations to both of you. Melissa will input her email.
She just put it in the chat. So maybe one more time,
Perfect.
Melissa, put it in the chat again, but thank you all so much.
Yeah, and you can just email Melissa to let her know. We'll find a way to contact you and deliver your prizes. Congratulations.
Okay, and Suzanne, do you want to give a reminder about next month's Treatment Tuesday?
Sure, a preview of coming attractions. So October 12th, we have Dr. Jenny Peterson and Sarah Sawyer, who's the head of the Kumar Center. Dr. Peterson is at a university in Iowa, and they're going to be talking about building competencies in air sensory integration and practice from going from a university level into, clinician and to master clinician. And so we've been in conversation all week, and you're going to love these ladies. They're just so delightful, and they have lots of good ideas. November 9th, we're going to have Dr. Margaret Bowman. She's a very eminent neurologist who's done seminal work on brain studies and autism, and she's been a practicing clinician. She's a friend, and they're going to be, and she's going to be with Dr. Isabel Beaudry, also a close friend who did lots and lots of work on pooping. She's our friend from Spain, but the very serious issues children have with fecal retention and urinary incontinence. So they're going to talk about general health and toileting, interoceptive kind of concerns, especially with autism. And then the last in our series, in our Southpaw series, is going to be December 7th. And we're going to talk about trauma and attachment, but we're going to leave on a high note, and we're going to do something on well-being and hopefully tips for well-being. And this is with Tina Champagne, who's been in the trenches with this for a very long time. So I think you'll enjoy the rest of our webinars. We hope you can join us.
How cool.
Thank you again, Lisa and Tracy. That
Thank
was
you so much,
really
everybody.
great.
Thank
And
you.
thank you to all our friends around the world. Thank you for joining us. We'll see you next month.
Thank you, everyone.
Have fun.
Bye-bye.
Bye.